My name is Josh Rozell, and I'm an orthopedic surgeon specializing in hip and knee replacement, and I'm also the arthroplasty site director at NYU Brooklyn. Growing up, I volunteered in an emergency room, and I became very fascinated with treating patients and changing their quality of life. So I decided to become a doctor to make a measurable difference in patients' lives, and I think orthopedic surgery is the perfect field to really appreciate that change over time. So I mainly treat patients with hip or knee arthritis, which is a general wear and tear of the cartilage. I also treat patients who have had prior hip or knee replacements in the past and have had issues or pain or things related to their hip or knee replacement that are troubling them. I think orthopedics is one of those fields where you can really have a measurable impact on somebody's quality of life and realize that change very quickly. So, a patient comes to your office with a specific problem, in my case, usually hip or knee arthritis, and I can offer them a lot of different kinds of solutions. And ultimately, if they choose to undergo hip or knee replacement, you can really see the change in their quality of life, almost instantly. I think in general, my treatment philosophy is really to understand where the patient is coming from and what they're looking for when they come and see me. Not every patient is interested in jumping into surgery right away. Everybody has different levels of function, things they want to be able to do with their lives. Some people, just walking to the kitchen and the bathroom is okay for them. Some people want to be skiing 100 days a year. So I think that understanding those differences and understanding, how patients are motivated and what their support is, I think that can have a huge impact on how I tailor my conversation with them. When patients come to NYU Langone, Brooklyn, I think that they can expect a very personalized approach. I work very closely with the physical therapists, the anesthesiologists, the care teams to make sure that all my patients are cared for appropriately and completely while they're here to make them feel comfortable in their recovery and when they go home.